with a special interest in stress management. She's also a UK certified coach. And it was during her gap year when she was living in Qatar in 2018 that Dr. Ezinne developed an interest in stress management. And since then, she has authored a book called Stress We Are Done. That book is so powerful. And, if you're someone that has a lot of problems with stress, you really want to connect with Dr. Ezinne after this. And she created a course that has been training African stress coaches, all this time. And also she teaches a lot, about stress management on social media and other platforms. So I'm going to stop sharing my screen now, and I'm going to excuse myself, and Dr. Ezinne is going to take over. Okay, Dr. Ezinne, welcome, welcome, welcome. So,
Thank
guys, let's welcome
you.
Dr. Ezinne in the comments.
Thank you so much, Dr. Mavi, for having me on your platform. I'm so excited. I believe that this is going to be a very, very impactful session where we'll be learning about stress management and diabetes control. So I'll be sharing my slides. Oh, can you see my slide? If you can share it, Dr. Mavi. Unmute yourself. Okay. So I believe you all can see my slide. If you can see, let me see you in the comment section. Okay. So today we are going to be talking about stress management in diabetes control. And yes, I'm Ezinne Nnamdi-Louis. Let's quickly get started. I'm sorry that we are starting late. So I want this to be as interactive as possible, okay? If you can just share with me, what do you think is a common struggle for people with diabetes in managing their blood sugar, in controlling their blood sugar? What do you think is a common struggle? This is not an exam. Just say anything that comes to your mind. There is no right or wrong answer. I just want to know what you think. Okay. When you see a diabetic, or you are living with diabetes and you're struggling with your blood sugar control, what are the things you've identified that makes it difficult for you to manage your blood sugar, or that makes it a struggle for you? What? Just let me know. Anything. Just let me know. Yeah, I see you. I see you, Amma. I see you, P Magic. Even if I just get one response, I'll just move on. Let me see. Remember, there is no right or wrong response. Just what do you think? Okay. Latifa says diet. Awesome. So diet is one of the struggle, okay, for people living with diabetes. In addition to the kind of medication they should use, lifestyle changes. Yes, Chinoso says unplanned meals, financial burden. There are lots of things that make some diabetes struggle to control their blood sugar, including healthcare accessibility. But there is one that most people don't usually talk about, and that is stress. Stress can impact on your blood sugar control, and that is why we are here today to learn about stress management in diabetes control. This is not a regular lecture that you hear everywhere else, and it's not something that is commonly talked about, because stress is one silent event that can hit, even without the person that it has been hit knowing that it is stress that is making them feel the way they feel or have this struggle they are having. So that is why you should try and be in this webinar to the end, and I encourage you also share this webinar with somebody so that they will participate and learn. All right, so we'll be talking about introduction, what stress really is, how stress impacts diabetes control, how diabetes causes stress, and how to manage your stress even better. Why I say even better is because I know that most of you already know about stress management techniques, different ones. So just flow with me. As a way of introduction, this is just few statistics. There are lots of statistics, lots of studies, lots of researches when it comes to diabetes control, diabetes, stress management, diabetes and stress, lots of them. So according to World Health Organization, diabetes is among the top 10 causes of death worldwide. This is one reason why you should listen to Dr. Mavi in this platform, in this her platform. Estimates of 1 in 11 of the world's adult population are living with diabetes. You may say, no, it's not true. But I must tell you that is it up about half, about 50% of people living with diabetes are not aware that they are living with diabetes. Okay, so that's why the first instinct may be, God forbid, this statistics is wrong. Most people don't even know. Now, you would you you would find out now that moderate or high stress levels increases the odds of diabetes 3 years later. So this is more like a serious issue. I'm not talking about the diet, the exercise lifestyle or any other thing else. I'm talking about stress now, the one that is not commonly talked about. Okay, so what stress really is? What is stress? If I start asking all of you right now what you think stress is, I know that some of you are going to tell me like, "Whoo, stress is bad, stress is terrible. Oh no, stress is this, stress is that." But I just want to have a basic understanding of what stress is when you're talking about when you're talking about stress. Is more of how your body respond to a demand. Okay, so stress is not just the thing happening to you, but how you respond to the events happening in your body and around your body, around in your surrounding. Okay, so it could be a demand, like you can see, yes, this is what's going on. It's so huge, and I have little resources to cope with this. Or it can even be a perceived threat. This is where you talk about mental stress, where you are not seeing the huge demand, but you're already perceiving it. Oh, maybe if I go out there, people may laugh at me. If I show up today, people may. I have this fear that people may not accept me. Perceived threat. The threat may not actually be there. So whether it's something tangible or something that is not there, so long as your mind has conceived it as a big issue, your body is going to respond the same way. And that is where stress comes in. All right. So going to the next thing, how does stress impact diabetes control? I don't know if you're following. If you're following, let me know in the comment section. And if you have questions while I'm talking, just put it down in the comment section, okay? Let's interact, let's learn together, and let's discuss. So, how does stress impact diabetes control? You may be wondering. There are several studies out there on this. And when it comes to type 1 diabetes, the one that is just insulin dependent, when you're talking about this, you're talking about stress can make them have high blood sugar levels or low blood sugar levels. So nobody knows which one exactly. So it's based on the individual involved. In fact, I'm going to talk more about this when we are talking about how to manage stress. Okay, to know how stress impacts your own sugar control. Because one thing I understand about stress, or one thing I've come to realize about stress, is that it's highly personalized, it's highly individualized. All right, so stress is not something that you say, because this person managed her stress that way, it will work for me. Or because this person is coping with this kind of situation, I would also cope. All right. So stress is highly individualized. You are going to find out what works for you, how your own body responds, okay, and what you can do to help yourself, not just the general stuff. All right. Now, I've mentioned that it can increase or reduce the blood sugar levels, and this is via direct impact of the stress hormone. So, what the stress hormone does is that when you're stressed, the body releases certain hormones called stress hormones. So, what these things do is that they make the blood sugar level to increase. Okay, When you are subjected to a brief or yeah, a brief amount of stress, when you're subjected to that kind of stress, what happens is that your body tends to increase the blood sugar level, makes your heart beat faster, makes you to start breathing faster. All these things are so that you be at increased alertness to handle or to surmount that problem or to surmount that situation. All right. So when your body is in this state, it means do something, get energized and tackle this problem, so that once you tackle it, you come back to your normal resting state. And that normal resting state is when the stress hormones have come down back to normal levels. Do you understand? But when it becomes a problem, when stress becomes a problem, is when you are subjected to high levels of stress all the time, to the point that these hormones don't come down. They are always at elevated levels in the blood. So in the situation of diabetes now, because the stress hormones causes elevated blood sugar, there is not enough insulin, or your body's or your body's insulin sensitivity is reduced to the point that it's not able to take in the increased sugar level into the cells. So it remains elevated in the blood, making it difficult for you to control your blood sugar, even with your medications. All right, that means you have to manage your stress so that you can achieve good control. In addition to other measures that you're using, other lifestyle measures or medication measures that you're using. All right. So that is the direct impact stress has on you, on the diabetic. However, there is an indirect impact. Indirect impact is from various habits, common habits that we um how would I put it? Things we do when we are stressed. Let me give you an instance. When you're stressed, and remember I talked about stress hormones, those hormones that gets elevated, some of them go to the brain. It goes to the brain and clouds your memory, such that you won't be thinking straight. And when you're not thinking straight, you're going to be forgetting things. And one of the things you can forget is forgetting to take your medications. All right. So when you're stressed, forgetfulness is one of the symptoms, one of the things that manifest in stress. All right. So another thing is some people manage stress different ways. Some people might start eating more. And the interesting thing here is that some people start craving for sugars. That's when you hear people say things like, I want chocolate, I'm stressed, give me chocolate, give me ice cream to cool myself down. It's not really what the body needs, but that's what the brain is communicating. Hey, give me sugar, give me sugar. Right? But that is not what your body needs when you're stressed. So when you're consuming these processed foods that your brain is craving, you're also impacting on the diabetes control. I don't know if you understand. So that's another thing. And then some people, the way they respond to stress is that they stay up worrying. They stay up worrying. And when you're not sleeping well, I know that Dr. Mavi has talked about this, the impact of sleep on blood sugar control and health, all those cardiovascular diseases and all of that. So when you're stressed and you're not sleeping well, you are also impacting on your blood sugar control. Again, smoking. I'm not going to give you a lecture of how smoking impacts on your health. There are lots of information out there regarding this. And then some people indulge in binge drinking of alcohol when they are stressed. Diabetes control, if you're trying to maintain a healthy lifestyle, if you're trying to maintain good blood sugar control, you are going to minimize your alcohol intake. All right. So these are indirect ways stress impacts on the blood sugar. I don't know if you're following. I don't know if I'm making sense. Let me know in the comments. Okay. I'm reading your comments. I'm seeing all you're writing. And I would appreciate if you're letting me know that you're here with me. All right, guys. So let's go to the next one. And that is how diabetes causes stress. This is known as diabetes distress. All right. So what are the things that happen when someone is newly, let me say someone that is newly diagnosed with diabetes? Even common diagnosis of malaria, you know that it can be distressing. Talk more of diagnosis of a chronic disease, and then you go to the hospital, they tell you things like, hey, you need to adjust your diet, you need to stop drinking coke, you need to stop taking processed meals, you need to cut down on this, you need to start sleeping, as in like a change of lifestyle, you know. You need to start be on this medication, you need to be taking this insulin injection. It's not easy. So most people with diabetes come down with what's called diabetes distress. So this one how diabetes causes stress. It can also be due to financial burden. If you're in a place where you're not covered by health insurance, you know how much you're going to spend on your health. Keeping up with doctor's appointments, keeping up with your medication, keeping up with the new lifestyle, all of these is can be a burden to someone that is just trying to cope financially. And then lack of social support. In a place where there is not adequate education on the impact of diabetes on people living with diabetes, it won't be easy. Due to that lack of knowledge, people around them won't really understand what they are going through, and they won't really know how to support them. All right. So lack of social support, family support, any kind of support from their peers, support from their workplace, support from colleagues, can make one feel isolated, distressed, frustrated. Then frustration from varying blood sugar levels, in the sense that you checked it today and you're celebrating, yay, I'm doing excellently well. Then you check it tomorrow, it has skyrocketed. It can be frustrating. Like, am I moving forward or not? What's going on here? And to the point of even giving up. There are people that can come down with clinical depression just because of this kind of variations in emotions, and it can be overwhelming, just like I mentioned earlier. And because you're now changing your diet, they're telling you to exercise better, you're trying to remember medications, even ordinary 3 days medication for malaria. Sometimes you forget one dose, but this time you're trying to remember, oh, I've not taken it today, oh, I need to take this. It can be overwhelming. And then difficulty accessing health care, like in a place, in an environment where you're not able to um get to a doctor quickly, or you're able to but you don't have enough finances to pay. All right. So these can cause stress to someone living with diabetes. This is outside the usual stress every other person goes through, like work stress, family stress. If you're a parent, parenting stress, a lot. It can be too much to deal with. So we are going to go to the next one, and that is how to manage this stress even better. Okay. The first thing I tell people is you must recognize your sign of stress. Okay, we are going to talk about recognizing your signs of stress, identifying your source of stress, avoiding ineffective stress management habits, and then practicing effective stress management habits. So the first is recognizing your signs of stress. Now tell me in the comment section, if you are stressed, how do you feel? How do you know that you're stressed? Tell me, come on, write something, write. Let me see. Forget about what I've written on the screen, okay? I want to know what is peculiar to you. How do you know? You're going to be telling me how self aware you are. How do you know you are stressed? Because one thing about stress is that it can be a silent killer, in the sense that people go through stress to the point that it's now a familiar thing to them, and they don't even realize it until something happens, until the high levels of stress bring them down, maybe to the hospital or even to death. That is how bad stress can be. Okay, Dr. Mavi says irritable, She gets irritable. Lara says restlessness. Come, right. Let me see. Let me read. Okay. She also says sugar cravings. Yes. So these are valid signs of stress, and it's good that you know what is peculiar to you. But the interesting thing is that I assure you that it's not just one words that I'm reading here that are your signs of stress. There are actually more. So irritability is one of them. The sessions I've had, webinars I've had, the first thing people talk about is headache. That one is common. It's like water, everybody headache. Restlessness is one of them. Sugar craving is one of them, because that's what your brain is communicating, even though it's not what your body needs. Difficulty concentrating, forgetfulness, fatigue, feeling overwhelmed, always worrying, backache, sleep issues, eating too much, eating too little, stomach problems, sexual problems, a lot of them. Stress will affect your emotions. Stress will affect how you behave. It can make you moody. If you're always moody, you find out that people start running away from you because they don't know if they are the ones causing you your mood problems. It's just you finding it difficult to manage your stress better. Hama says she hardly breathes. Fumisho says headache. So I am going to give you guys an assignment moving forward, like from today. The essence of this lecture is for you to become aware of of stress and the dangers of stress, and also how to recognize your own signs of stress, and also how to know what helps you manage your stress better. That's the essence of this lecture. So I'm going to give you an assignment, and that assignment is, from today moving forward, when you are feeling unusual, when you are feeling that you're not in your place of rest, can you put a name to how you're feeling at that moment? Put a name to it. For instance, I used to think that when I'm stressed, I just get headaches. I just get headaches until I start becoming more aware and realize that I become very moody, you know, always having mood swings. But when I started learning about stress management and becoming an expert in the field, I didn't even know when the mood problems went away. So, moodiness, I'm telling you about myself. Is self-awareness that can help you know these things. The one I realized recently is that I get shoulder stress. And once I do the exercises that relieve shoulder stress, I get instant relief. But I won't know these things unless I'm self aware. Another one I've realized recently is my eyes. It shows in my eyes. The first time it happened to me, I had no idea that it was stress impacting me. But with increased awareness, I now know, okay, when my eye starts doing somehow, it shows that my screen level, my exposure to screen is becoming high, and I'm getting stressed. So I need to shut down whatever I'm doing and go and take a break. So recognizing your signs of stress early enough is what makes the difference, and not waiting for it to send you to hospital. Stress has sent me to hospital. Not just once, not twice. I'm not proud of it. All right. And not waiting for it to bring you down, not waiting for it to make you lose valuable relationships because of attitude, just because you're not managing your stress properly. Now, the next is identifying your source of stress. I know that this looks easy. You can say, if I ask you guys now what's making you stressed right now, the first thing is going to be, now money, oh, I don't get money, oh, I need money, oh. That's going to be the first thing, you know. But most times you realize that it's actually beyond that. It's actually more than that. When you think deeply, you realize that there is something actually making you agitated, making you irritable, making you lose your sleep. It's not just money. It can, if you think deeper, you'll be able to narrow it down to something specific that happened. Maybe it's just as simple as a colleague that makes you angry in your workplace, and then in addition to your money problems, you are becoming a tiger that cannot be tamed. right? So you are going to identify what is the source of your stress. What exactly is it? I'm talking about what exactly it is, because what could be your source of stress today can be different from what's your source of stress tomorrow. So you're going to be intentional. And that's why I said practice mindfulness every day. Mindfulness means being present. Let me give you an instance of what happened to me. Um, I realized that one morning I just didn't want to talk. I was angry by default. As in just angry. Like if you talk to me, I may shout. But this wasn't me. This is not the kind of person I want to be. This is not my values. So I had to think. When I got to work that day, I had to think, what's actually going on? I realized that I had issues the previous day that were unresolved, that I carried it to the next day. You see? So the person, let me say that if I, okay, for instance, this issue I had the previous day and I didn't resolve it, and it's still lingering, making me angry, and then today Mavi talks to me or tells me something and that I don't agree with, instead of the usual way of communicating, okay, this one we know what, let's try this other way, then I get angry and start shouting, raising my voice. So instantly, I may think that Mavi is the cause of my stress. She's not the cause. Unless you think deeper, you realize that the cause of my stress is actually what happened the previous day. So you're going to be intentional in practicing mindfulness, know what's going on. Is it the financial burden of the medications you're going to buy? What exactly is going on? Because if you don't know what exactly is going on, you're not going to know what you are trying to solve. It's as simple as that. Let's go to the next one, which is avoid ineffective stress management habits like smoking. I've had people that smoke not because they enjoy it, but as a way of coping with stress. And today they are now addicts. All right, smoking does not help. There is no, not even a single benefit of smoking. None. So I won't dwell on that a lot. Excessive alcohol intake, it doesn't help. Overeating or undereating. For a diabetic, you know the importance of diet when you're talking about diabetes control. Dr. Mavi is an expert in that. So you guys are with her and she's an expert in that. Like you know, you can't afford to eat excessively, and at the same time you can't afford to undereat, and at the same time you can't afford to eat just anything just because that's what your brain is telling you, like your brain communicating processed foods. No. So it's an ineffective habit. And then another thing that happens when people get stressed is that they tend to withdraw from people. You hear things like I don't want again. No, no, no. I don't want to work with you guys again. Everybody should be on their own. I don't want. Just leave me alone. Stay on your own. Withdrawing from support is not the best way to go. Because one thing you have to realize is that when you are surrounded by supportive people, first of all, you're blessed. And when you're surrounded by supportive people, they have your best interest at heart. These are people looking out for you. These are people that care so much about you that they can't see you fail. They can't afford to see you go down the drain. But when you push them away, it's unfair to yourself and also to them because they care about you. So, withdrawing from support is not an effective stress management habit. So, if you're the kind of person that shuts the door, you want to lock your room, you want to lock yourself out, you want to run away, you want to shut down from social media, from communicating with people on WhatsApp because you're undergoing stress, come on, it is not the best. There are other ways to go about it than running away from people that care about you. Okay. I don't know if I'm following. Let me know in the comment section, please. Please let me know. So it won't be like I'm just talking to myself. All right. So now let's talk about what are the effective ways to manage your stress. Now, I know you can see my screen. I know that I've written some things that look generic. But before I come to these things that look generic, I want you to know this. Managing stress is highly individualized. And no matter what you read from this screen that is before you, remember that what's more important is identifying your source of stress and recognizing your signs of stress early so that you can take action as quickly as possible. That is what makes the difference. All right? That is what makes the difference. So, one of the things you're going to do is when it comes to stress in diabetes control, one of the things is you're going to recognize how stress impacts your own sugar control. All right. I've told you that in people with type 1 diabetes, sometimes it causes high blood sugar levels, and sometimes it causes low blood sugar levels. And in people with type 2 diabetes, it mostly causes high sugar levels. But for you that is listening to me, or you know someone that is living with diabetes, how does stress impact your blood sugar levels? That means you're going to start journaling, right? You're going to start journaling. I prefer that people come up with their own personalized stress management habits than the generic thing that is out there. Practice mindfulness, breathe deeply, drink water, do this, do that. Come up with your own stuff. And how can you do this? Each day or at the end of every day, ask yourself, did I notice any changes in my emotions or in my behavior? You don't even have to wait for the end of the day. As the day goes by, any changes in my behavior? Any changes in my emotions? Any changes in my responses to people? Is this different from my values? Okay, I noticed the changes. So I write it down. What changes did you recognize? Put a name to it. Well, did you become irritable? Did you become moody? Did you start eating more? Were you having headache? Write it down. Now, what happened? What happened before this change occurred? That's identifying the source of your stress. Write it down. And then what did you do? What did you do? How did you respond to that changes in how you feel? How did you respond? Write it down. Now ask yourself, the way I responded, is it the best? Did I go smoking? Is it the best? What will I do differently next time that is even better? And if you want to take it a step further, you can even record your blood sugar level at that moment. Did it cause an increased sugar level? Did it cause a reduced sugar level? Did it cause a normal sugar level? That is individualized. That is a highly personalized technique that is as it is better than the generic stuff. All right. So now you've identified your own stressor and you've identified the kind of things that work for you. You can now add these extra ones to it, like sleeping well. You have to sleep well. You have to sleep well. I'll say it again. You have to sleep well. I know that people talk about, I don't rest when I'm tired, I rest when I'm done. Okay, okay, you can, but your brain is calling, your heart is calling, your muscles are calling, your mental health is calling when you don't sleep well. All right, so sleep is very, very essential. Even in your blood sugar control, sleep is essential. Now, what makes a good sleep? A good sleep is not just in the number. I know science says it's 8 hours, but for me, I would say, um, don't quote me anywhere, please. So the disclaimer is there: don't quote me anywhere. But I would say from 6 hours upwards. Why I'm saying from 6 hours upwards is that I've communicated with lots of people, including myself, and I've realized that for people that have to wake up every morning go to work, come back, take care of their other activities, run their business, do this, do that. 8 hours seems to be like luxury, you know. So at all, if you can get at least 6 hours. But what's more important is the quality, not just the number. Quality sleep is you're waking up not feeling tired. When you wake up, you feel refreshed in yourself. You can tell yourself the truth. You're not having headache throughout the day. You're not feeling sleepy during the daytime. And you're very alert to work for the day. That means that you've had good sleep, quality sleep. All right. Now, the next one is exercising. You just have to exercise even better. Reduce overwhelm. One thing I tell people is once you may open your mouth and say, I'm overwhelmed, it means you can't take in more work. You can't. So if it's difficult for you to say no, open your mouth and say any o. If you can't say no, say any o. Or you get a pen and paper and write it boldly, no, to people that are asking you for more work. I can't. So once you acknowledge that you're overwhelmed, you just can't take in more work until you sort out what's making you overwhelmed. If not, from overwhelm, it will go to burnout. And burnout is not something you want to experience. Trust me, I've been there. It's difficult to recover from. It looks like depression, although it's not depression. So reduce overwhelm. Now, when you feel that you just don't have the resources to cope with what's going on with your stress, find a way to start increasing your resources. What this means is that you're going to be more solution focused more than problem focused, because if you're someone that is problem focused, your brain will keep expanding the problem, it will keep expanding the situation, making it even more difficult for you to surmount. So increasing your resources is telling you, oh, what's going on now? I don't have money. What am I going to do? What am I going to do? Instead of only seeing the problem like there's no money, you're now thinking of the solution of what to do. How do I increase my income? Is there any place I can cut down expenses so I can have more money to solve this problem? Is there any way I can get money? Is there any funds I can apply for? So you're becoming more solution focused. And one interesting thing about being solution focused is that you start seeing opportunities. I don't know how it happens. Some people will tell you it's the universe. Universe will start bringing things to you. I don't like talking about universe when I have my God. So, so you just start seeing opportunities around you. Okay, so move from being problem focused to being solution focused. It will help you even better. Eat healthier meals. That your brain is craving sugar and processed meals and fats does not mean that's what your body needs. When you are stressed, your body is lacking essential vitamins, and Dr. Mavi knows that that there are vitamins that helps in diabetes control. So when stress depletes some of these vitamins, it will also be difficult to control the diabetes. So you need to eat healthy meals. Your vegetables have loads of them. Your fruits has loads of them. That's what your body needs, not those processed sugars, ice cream, and stuff like that. Now, if you want to distress instantly, like you're hyperventilating, problem have happened, issues have come up, and you're angry, you want to respond, you want to react, and you know that if you react, it may make you regret your actions, or it will just make you feel terrible about yourself, and it will also impact on your blood sugar. Just breathe deeply. One hand on top of the other on your tummy. Just do it as long as you want. All right. It can be difficult to stay focused when you have raging thoughts. So what I usually recommend is first get a pen and paper and write down all those raging thoughts. Release them from your brain. Release them. All right. You can write, you can talk to someone. When you are done, then you practice the deep breathing to help the stress hormones come down to their normal levels so that you can think even better and have more clarity to make decisions. All right. And then, if you are so overwhelmed that you can't cope, please speak up for help. I can sing this as a song. Speak up for help. Please speak up for help. It's very important. Okay? You don't do life alone. Don't do this alone. There is a lot going on already. So if you try to run alone, come on, it's going to be very difficult. So speak up for help. Speak to the right persons. It can be a trusted friend, a psychologist, a coach, anyone, your medical practitioner, Dr. Mavi. Speak up for help. We are here for you. Okay? So, and in conclusion, being diagnosed with diabetes does not make you less human. You are just like everyone else, capable of living a long and fulfilled life. Like in my practice right now, where I work, I see patients that are in their 80s, 90s living with diabetes. So, and I greatly encourage you to take care of your health, use your medications, and watch your numbers. Thank you, guys.
I just had to do that. I just had to do that. Thank you so much, Dr. Ezinne. So, guys, please let's appreciate her in the comments. Thank you so much, Doctor. Thank you so much. Like, I learned a lot. I had to at some point. I started taking notes, right? Because I didn't want to forget some of the things you were saying. So, thank you so much. Please let's appreciate Dr. Ezinne. Thank you so much, Dr. Nnamdi-Louis. This stress thing. The last point you made, you said speak up. The truth is, Dr. Ezinne has changed my perspective on stress. Before I used to brag about being a workaholic. It was my identity, until she started teaching me about it. And when she says speak up for help, believe me, I understand what she's saying, because I've had situations where I was drowning, and when I spoke up, when I told her about it, like, this is happening, and then immediately she just called me and we talked about it, and that helped to calm me down, and I was able to cope with that. So this is really, really important. And for everyone else on this call who will be saying, "Oh, how do I meet Dr. Zine?" Don't worry about it. At the end of this broadcast, I'll be sharing with you an easy way to get across to Dr. Izine free of charge. Okay. So just hold on. I'm going to be sharing how to get across to her and talk to her and have her help you with your stress for free. Okay. So I also want to say that the thing she's been saying about stress impacting on blood sugar also, you know um it also pertains to people who are not diabetic. Okay, because stress can put you at risk of type 2 diabetes. Okay, so the same thing, the same way, with your stress hormones, with you overeating, with you smoking or drinking, all those things she mentioned that can worsen blood sugar can also, okay, put someone who is not diabetic at increased risk of diabetes. So this cuts always. All right. So I'm going to I'm going to show you that. So one other thing that you need to also know is that when you're dealing with diabetes, one sure way to take care of stress is to be in control of your blood sugar. All right. So she mentioned it that some of the things that stress someone that has diabetes is that fluctuating blood sugar level. So it means that everything counts. Okay, so don't just focus on only your stress. She mentioned diet, exercise, everything counts, even the blood sugar itself. If you learn how to control your blood sugar, if you're no longer afraid of what the numbers are, your stress levels will be greatly decreased. Okay, so and then which will in turn also control the blood sugar. So you see, stress impacts blood sugar impacts stress. And I've put together a book. Okay, it's called the Ultimate Diabetes Control Book. I don't know if you can see it. And this is a handbook that will end your anxiety, to end your stress over diabetes. Okay, it will put you in control of your blood sugar levels. This is so important. Like, you will actually be in control of your blood sugar levels going forward. by all the tips that I've put together in this book. You're even going to see some of the mistakes that you are making, that can put you at risk of diabetes. And for those who have diabetes, that would help, that are increasing your blood sugar levels, stress included. So this book would put you in control. You will learn how to handle your blood sugar going forward. It's available in soft and hard copies, but for now, it's available for only pre-order because the book will be launched in 2 weeks. So, what are you going to learn from this book? You're going to learn how to control your blood sugar every single day. Like it's going to end your anxiety always. Okay. You're never going to worry about what your blood sugar is. Then it's going to show you 15 costly mistakes, like 15 of them that people who have diabetes are doing every day. 15 mistakes they are making that are impacting their blood sugar negatively. All right, you're going to identify diabetic emergencies. This is very important because what causes a lot of problems in diabetes is the diabetes emergencies. All right. So many people come down with diabetes emergencies and they are unable to handle it, and that can lead to death. So you're going to now learn how to identify these emergencies and what to do, okay, to prevent loss of life. Then the next thing, you're going to learn some food hacks that would help you enjoy your meals while keeping your blood sugar in check. And I know this is very important for everyone living with diabetes. And then you're also going to learn how to reverse prediabetes. Prediabetes is a condition where you are not yet diabetic, but your blood sugar is high. Okay, so you need to learn how to identify it and how to turn it around so that it does not lead to diabetes. All right, like I said, this book is available for pre-order right now. So, in addition to the book and all the amazing things you're going to be getting, you're still going to have 30 minutes free stress management consultation with Dr. Ezinne. You've heard her speak. Now, imagine when you actually have 30 full minutes with her free of charge, where she can help guide you, a personalized approach to your stress. Okay. She can help take care of your stress in 30 minutes. So this is a huge one. Okay, this has really helped me. I know it's going to help you. And that is if you pre-order this book. This is available for people who pre-order this book. Okay. Then also you have a journal. She mentioned documenting your blood sugar. One of the ways to really be in control of your blood sugar is by checking it regularly and writing it down. That is how you know when you're getting better. That's how you know when what you're doing is working. That's how you know even when your stress is impacting negatively on your blood sugar, right? And then finally, you're going to learn my own personal healthy weight loss formula, all right, which would help you to control your weight if you're already on the big side and to keep it off. This is science-backed approach to weight loss, okay? Very healthy and it's guaranteed that you're going to lose weight. So, how do you pre-order this book? Let me tell you. So, the price of this book for the e-copy, that's the soft copy, is going to be 3,500 in 2 weeks when it launches. But for anyone who pre-orders in the next 48 hours, so that's between now and Monday, okay, you're going to be getting it at 30% discount, which is 2,500. All right. Then the hard copy, if you want to pre-order the hard copy, is going to be 5,000 naira in 2 weeks when it's launched. But within the next 48 hours, it's going to go for 4,000 naira. All right. So these are some of the benefits for people who will be from this webinar, okay, who would say that they are ready to pre-order the book. All right. So now the main reward for anybody who pre-orders in the next 48 hours is they're going to have access to me, all right, not just Dr. Ezinne now, all right. If you pre-order the book, even after 48 hours, you still have access to her. But if you pre-order the book in 48 hours after this webinar, all right, you're going to have 1 hour with me, all right. You're going to have a group question and answer session for everybody who pre-orders the book between now and Monday night. All right. And you're going to have 1 full hour with me together, a group where I will be helping solve your health problems, diabetes problems, questions you might have, answering your questions about your life, your health issues in 1 hour. All right. So that's for only people who pre-order within the next 48 hours. But if you pre-order between now and the next 2 weeks, you get the other benefits except for this 1 hour consultation with me. Okay, so how do you pre-order? It's very simple. Send a message to this number, text message, call, WhatsApp this number, or reply to the number that sent you a message on WhatsApp. Okay, some of us here got messages on WhatsApp. Okay, so you can reply and say, I want to pre-order, or you can take this number on the screen right now and send a message or call or send a WhatsApp message to pre-order. You can also drop your messages on this stream on the stream, and we can see it, later, and say I want to pre-order. So these are the ways you can pre-order. And right now, I'm going to bring Dr. Ezinne back on to answer just three questions right now. If you have any three questions that are on the topic stress management in diabetes control, and after that, we'll call it a night. Okay. Thank you very much. So remember, if you want to pre-order, just let us know. Take the number. You can screenshot it and send us a message later. Within the next 48 hours, you'll get the 1 hour consultation with me. Okay, it's a group session along with the other benefits I mentioned. All right. So these are some of the benefits. Okay, the health weight loss formula, the diabetes journal, and 30 minutes with Dr. Ezinne. And also you get a price discount. Okay, 20% discount for the hard copy and 30% discount for the soft copy. All right, so Dr. Ezinne, we're coming back to you right now, and if you have any questions, please ask right now, and Dr. Ezinne will answer. Please ask your questions in the comment section, and you know um Dr. Ezinne will answer. So if you have any questions, please ask and I will highlight.
While we're waiting for questions, um, about the book when you were talking about it, I saw the place you mentioned about handling diabetic emergencies, and I was like,
Yes,
yes, this is it, this is it, this is it. This is something that people actually die from. So having it written down, what to do, it's very, very important. It's very, very important. Even as you were talking, I was like, "Eeh, I wish there is a way you would market this book or put up an advert so that many people would have access to it. Many people would have access to it because it's very important. Millions of people, when I was making research, I found out that millions of people die every year due to diabetes and diabetes related complications. Millions, I didn't say thousands.
that is
So
true.
when
And
you
we're going
see,
to make it available to a lot of people. Okay, people are
yeah,
going to, yeah. So thank you so much, Dr. Izini. People need to know that, when we are on call in emergencies, that one of the cases that we see almost all the time, is actually diabetic emergencies. They
yes,
come in almost every single day, and not all of them make it out alive. So people need to know, and that's one of the things that, made me really want to document it, that this is how you can even know it's happening. People don't know it's happening until it's too late, right? A person slumps. They don't even see it happening. But there are signs. It shows
yeah.
signs, that the person or the caregiver can see. So I'm really happy that you highlighted that, because that is very important. And doctors know that this is a very important problem because we see it all the time. So Dr. Zine, somebody just asked a question and I'm going to highlight it on the screen. Said, what time is best for an adult to sleep at night?
The best time to sleep at night. Well, if you type on Google, you will see different things. But this is what I recommend. I'm not interested in the time. So long as it's night, when when the sleep hormones are there, are elevated for you to get the rest. That's what's more important. It's night, one, and then two, you're getting adequate quantity of numbers. That's the number of hours you put in. And then three, you're waking up feeling refreshed. That's what's more important, because if you start restricting yourself and say, because science says I must sleep at this hour from this hour to this hour, and then maybe in a day you didn't meet up with that time, what's going to happen? What are you going to do? Feel bad about yourself? Lose your sleep? Sleep fewer hours so that you can meet up with the time you're waking up? No. So what's more important is you're sleeping in the night, you're putting in the number of hours, good hours, and you're waking up feeling refreshed. Does that answer you?
Okay, thank you so much, Dr. Ezinne, for this, for the answer you gave. Yes, honestly, and I'm going to add something, a little bit to that answer. I'm going to say that, so like she said, like Dr. Ezinne said, there is no specific time per se, that you should sleep. You should want to sleep when it's dark, like she said, when, because light affects your sleep hormones. Okay, the way nature made it, your sleep hormones are supposed to be higher when there is no sun, when there's no light. And then they start dropping in the morning when the sun comes out. All right. So, and this is very important for even blood sugar control, for weight gain, for a lot of even psychological, processes, that you sleep when it's dark and you wake up when it's bright. So we're not going to say, oh, 8 p.m. is the best, 9 p.m., 10 p.m. But like she said, when it is dark, right? When your sleep hormones have risen enough for you to go to bed, that is the best time to sleep. And then you should wake up, in the morning when the sun is about to come out, and then, so that it can get into your eyes. Because when you get light in the morning, it prepares your body, all right, for the next night of sleep. So getting light in the morning into your eyes is important for you to sleep the next night. That is why people who do not get sunlight, right, don't sleep well at night, and they don't know that there's a relationship between the two. Now, but I would go a step further to say that it's also important, especially if you are someone who is struggling with sleep, to have a set time for sleep. And how do you do that? Because the brain is a creature of habit. All right, the brain sets in anything, like whatever you teach your brain, it will do, basically. All right. So if you're struggling with sleep, you're someone who doesn't sleep very well, one of the advice that I'll give is for you to have a set sleep time. For example, you know that you should sleep for like 7 hours on average, right? 6 to 8, the minimum, the let's say the what's that? The average is 7 hours, right? So 7 hours of sleep every night. That is what science recommends, right? Now, you now say, okay, I'll sleep. That is you now deciding to sleep from 10 to 5. That's 7 hours, right? Or 11 to 6. So that's what that does for you, is that it takes you to, you sleep when it's dark, you wake up when it's bright, like Dr. Zine said. But it goes a step further to give your brain something to look forward to. So your brain now knows that when it's approaching so time, I will start feeling sleepy. And it works. All right. I do a lot, my patients use it a lot. So it doesn't mean that if you're not able to sleep at that time, that you will now not sleep again. No. It's just that you're trying to train your brain. And this is for people who are struggling to sleep, right? You train your brain to start seeing a particular time as its sleep time. So that helps you to sleep better, because once that time is approaching, your brain starts to shut down. Okay. So I hope that answered your question. So the next question, I'm going to put it up right now, says Dr. Zine says, if stress is a human being that you see every day, how can one manage the stress?
So the source of your stress is someone you see every day. That's what it means. Okay.
Yeah,
So if, for instance, let me say somebody you're living with or it's your work colleague, first things first, you need to communicate. You need to communicate the concern. What's going on? Is it that this person is causing you stress? Is it by their attitude? Is it by the way they talk to you? Is it by a behavior? Sometimes people cause you stress and they don't even know. So what is it they are doing? You have to speak up. Speak up for change. There are these 4 A's that are usually used in managing stress. They will tell you things like the first A is avoid. Avoid the source of stress as much as you can. So in this case, this is a human being that you just have to see every day. Maybe the person is living with you, or like a spouse. You can't avoid the person. You can't just carry your bag and leave, or you can't just quit your workplace. So you go to the second A. The second A is adjust. So adjusting here means you have to find a way to speak up for change. So what's going on? Can you tell me that you're telling the person, sorry, before I get there, if you are speaking up for change, you must be polite about it. You must speak up calmly. All right. It's not everything that is fire for fire. Like you are going angrily to confront somebody, it will cause conflict and cause even more stress. So if you're speaking up for change, you're going to politely discuss with the person and find out what's going on and how both of you can come to an agreement to enjoy peace of mind together. Now the third one is adapting to the situation. So it can mean changing your perception, changing your perspective about the situation, or and that could be giving excuses for the person. Okay, maybe this person is stressed, that's why they are behaving this way, or maybe something happened to them, that's why they are behaving this way. Or you can tell yourself, for instance, when I was working in a place where the work environment was quite toxic and I had to be showing up to a boss that was causing me a lot of anxiety. It really impacted on me. So what I told myself, how I adapted was telling myself, okay, this workplace, I have to just be here for a limited amount of time. And after it, I'll go. So let me use this workplace as just a learning opportunity. All right. So that kind of mindset changed it all for me. So instead of going to work, seeing a terrible boss, I was now going to work with the mindset of let me just learn so that I can move to the next level. And I was seriously activating my exit plan to the next level. So that helped me cope with the situation. I stopped seeing my boss as the angry, terrible boss, and I even started seeing the good side of her. All right, so that's adapting. Now, the final A is accepting. Accepting means you are now accepting what you can't change. Accepting what you can't change. But the caveat there is if your life is threatened, please run. If your life is threatened, please run. I don't know if that answered your question.
Well, it answered it for me, so I hope it answered it for the person who posted it. I can't see the name anymore. So I like that. So a change in perspective really helps. You know, stress is how we respond to issues, not the issues themselves. So how we think about those issues, how we react to those issues, how we respond to those issues are actually what stress us out. And if your health or your life is being compromised, then run. Thank you so much, everyone, for coming to this webinar, and for those who are going to be watching it, on the replay. Also, take your time, watch, and if you have questions, still drop them in the comment section, and we will answer. And if you're watching even live and you think of something you'd have asked, still ask. Myself and my team will still go through and see questions that we can answer. So, okay, she said yes, doctor, for the answers. You nailed it. Okay, so thank you so much, everyone, for coming. We are sorry we started late. Thank you for staying to the end and pre-order the book, okay, so that you can get all the benefits alongside the 1 hour with me, because I really want to help you manage this problem and even help you prevent other health problems. So thank you so much, Dr. Ezinne, for teaching us about stress. My goodness, like I learned so much. I need to go and sleep because because I have to I have to practice what we've been taught this night. Okay. I have to practice what we've been taught this night. So I need to also sleep. Thank you so much for teaching. Thank you for pouring out your heart on this platform. And thank you for answering when we called you. Thank you
I
so much.
appreciate. I appreciate.
Thank you.
Bye
So
bye.
please, can we just say thank you to Dr. Isn't in the comment section? Thank you so much, Doctor. We appreciate you coming here. And we're going to communicate with everyone. We're going to send the live video, the replay of this video to everyone, okay, so that you can watch even after now. So you can also share it to people who need it. So expect the replay in your inbox. Thank you very much. Stay tuned because we'll be having more of this series to help you. We really, really, really want you to feel better. We want you to prevent illness. We want you to control all kinds of illnesses. So we're going to be teaching you a lot. And also remember to get this book for you and for your loved ones who are at risk of diabetes or who already have diabetes. So until next time, stay Stay connected in the group. Have a lovely night. Good night.